the biggest thing is like be relentlessly curious about like HIV care or anything in general. Like if you want to study peds, be relentlessly curious about peds, right? Understand that whatever field you go into, it's going to be fast paced, especially HIV. It's always moving, it's always changing. So if you're not really reading guidelines, journals, or really going to conferences, having friends that challenge you to think about new innovative treatments or prevention options, then you already like low-key kind of behind. So you need to really just be curious about it.
Welcome to Let's Get Real, a candid conversation series about leadership, impact, and what it really takes to show up with purpose and authenticity. Today's conversation is titled Clinically Driven, Purpose-Led Leadership Lessons from the Front Lines of HIV Care. Our guest is Dr. Tyris Ford, a board-certified family nurse practitioner, educator, and leader in HIV care. So welcome to the Candid Conversation. How are you?
I'm excellent. I can't complain. I'm super excited about our conversation. And, it's always good to be in the presence of you, Doc. It's
Oh,
always great.
thank you. And you as well. When I see you, I smile. So I want to, I know it's the vibes that you put off. I really appreciate that. So I want to start this off because I've been excited about this conversation by asking what led you to focus your clinical practice on HIV care and how it has shaped your approach to leadership.
You know, um, this is always I always lead by saying, this really was a calling for me. It wasn't just like a career. When I thought about nursing, I was called to it. And when I thought about advancing my practice, because I was a nurse prior to like maybe 5 years, and then I decided to go back into NP school, and I knew I wanted to advance my practice, but really it was a statistic that kind of shaped my whole perspective, especially around HIV. It was back in 2016 where the CDC had released some research really indicating that 1 in 2 Black gay males would acquire HIV in their lifetime. And to me, that was like crazy. Because I'm like, that's my friend, that's my brother, that's my cousin, like that. And I'm looking like, okay, which one is it going to be? And how anxiety provoking that is, knowing that I don't even have really a healthcare provider who really understands what I'm like experiencing. I said, well, how can I what can I do about it? So I really switched my focus from being in the ICU and going into nurse anesthesia into being a primary care provider and really focusing on being in HIV care. And I like HIV care because it really just is not just about a person living with HIV. It really is the intersection of like social justice, humanity, right? And then science, right? So we get to play around in all of that. And I really feel that it really helped shape my leadership style in a way of embodying resilience,
Mm,
like in my own experience, just advocating for myself, trying to get on PrEP to prevent HIV, and then also experiencing the stories from people living with HIV and what they had to go through and how their life was, especially like transcending through some of the interventions that they had back in the 80s
right.
versus today, right? And so it really taught my leadership style, like how to listen more, how to empower my patients, and
Mhm.
then really how to stand firm in the face of stigma,
Right.
because there's still so much stigma that exists around HIV. And I'll say, lastly, HIV care has really helped me expand my thinking beyond like the exam room. Like I said, it's just not about caring for HIV itself. It's recognizing that this is a person living with HIV and that they are so much more expansive than just their diagnoses. And then how can I help them? I can help by advocating for them, being in policy, addressing inequities,
Mm.
changing healthcare structures. So, I really feel like this was a calling for me to get into. And then I look like my people. So
Yeah.
that was another thing. Like, why not? Why wouldn't I be in this?
I love that, Dr. Ty, because I always remember as a nurse, when you take it back to our the expectation of what we do as professional nurses, and that is to advocate, that is to ensure we're providing culturally sensitive care, that is to make sure we see people as individual. All of that is encompassed in terms of our professional practice. And so I love how you started with, you were called to this because you were called to do all of those things, and this is how you're now living it in terms of your practice. So thank you
Absolutely.
for that. Unfortunately, you're speaking to someone that worships the professional practice of nursing. I feel like when people understand what that means wholeheartedly, which is clearly you do because you articulate and you started there.
Yeah.
I think when people get that, you get this profession that, and again, we're here to serve, no matter who, what you look like, we are here to provide care. That's what our profession is all about. So thank
Absolutely, and it takes a certain person to be a nurse for
you.
real, like, it's not just about, there's some people who are like, "Oh, I can't do blood, I can't do all the, patient care things, I can't do the bodily fluids," but even beyond that, you
Mhm.
gotta know how to, like, care for people. You gotta have a heart for that, and if you not cut out for that, then this profession may not be suitable for you, but, of course, you can find other ways to help people, but I just love, helping. And
Absolutely.
I've always been like that. So nursing just fits so perfectly in my life. So, and then just to scale it up, when you get into nursing, the beauty about nursing is that there's so many avenues that you can go into, right? And so I
Yeah.
just landed on HIV and yeah,
All
and
right.
I
So
am.
I'm not going to side rail this conversation because I will. I didn't. You said three things that I would like to continue to talk about, but we have goals and objectives for this conversation. So I'm going to
Okay.
get back to those. So thank you. The other question I have for you is all around the critical advances in HIV prevention and treatment. So, what are some of the most critical advances that you've seen today that healthcare providers should be paying attention to?
We've definitely come a long way. I just gave a little example, and just for our audience that's listening out there, like we went from having like a bag of, and this was before my time, y'all, but that we had a bag of medicines that people used to take. Literally, we would call it the cocktail for like HIV treatment. And now we advance from that down to just a few pills, 3 pills, maybe 4, all the way down to a single tablet being used as HIV treatment. And now we have even more innovative options where people can get injections to help with treatment. And then when we talk about prevention, pills versus injections, so we've made a lot of progress. I just want to acknowledge that. Um, but one of the well, a few of the new critical advancements that providers really should be aware of is the new release of a Yes to Go, which is lenacapavir. It's like our first FDA approved twice yearly PrEP, and that stands for pre-exposure prophylaxis injection. So twice a year, you come into the clinic and you get an injection to help prevent HIV from happening, and this is 99.9% it has 99.9% efficacy. And this is what in some big trials that will happen. I'm gonna spare y'all all the details, but it's really transformative and like providing equity, access to care for those who can't take pills. This is an option for them. And then we have, in along the lines of prevention, we have Apretude, which is another injection that individuals can get. It's cabotegravir, it's an integrase inhibitor, which really is used to help fight off the HIV infection. And that's every other month. So every 2 months, they will come in and get an injection. And this is really helpful for like my flight attendant or my executive who don't got time to really be taking a pill or may forget a pill. They travel a lot. This may be very helpful for them. And then we also have along the lines of prevention, doxycycline as STI prevention. And so this antibiotic we use for many infections, but we can also use it to help prevent the incidences of syphilis and chlamydia, along with gonorrhea, and people who are, as I like to say, are priority populations. And when it comes to treatment, I do want to just touch on this really quick. We have Cabenuva, which is an injection for people living with HIV that offers them an option of every other month or monthly injections to help treat their HIV. And we do have some undergoing studies that providers should be aware of, where there is a every 6 month option that could be potentially released soon for people living with HIV, where they can get 2 injections per year. And think about how that would be like a game changer, from going from taking a cocktail of pills down to an injection twice a year. That increases the access. That's reimagining what like HIV care looks like for people living with HIV. So those are the major like innovative critical things I would say, or critical advances I would say providers should be really aware of right
Mm,
now. And there's even more that are coming out. So yeah,
nice. Thank you so much. When
that's
you think about clinicians and learning more about HIV care, what advice would you give your like colleagues who want to deepen their expertise in the specialty area of HIV?
The biggest thing is like be relentlessly curious about like HIV care, or anything in general. Like if you want to study peds, be relentlessly curious about peds, right? So just understand that whatever field you go into, it's going to be fast paced, especially HIV. It's always moving, it's always changing. So if you're not really reading guidelines, journals, or really going to conferences, having friends that challenge you to think about new innovative treatments, or prevention options, then you already like low key kind of behind. So you need to really just be curious about it. I also would say, beyond being curious, get you a mentor or get you a friend that challenges you. I love having my like colleague. She's always like, okay, do you want to study this week? I had this clinical case. Like, let's go through it. And I'm like, okay, bad, let's do that. And we usually share our clinical expertise. We talk about the clinical case. We may even reach out to some of our mentors that we have access to, resources that can provide us more insight. So I would really encourage you to get a mentor, and then also be a mentor, be willing to learn, be willing to share your expertise, right? And um, get involved. That's the other way to learn about HIV. Like, don't just be in the exam room in the clinic and thinking that that's sufficient. Like, get out in the community, go advocate, go be around people living with HIV, go see what's going on in the community. They will let you know. They'll give you new lingo that you need to be up with. They'll tell you what it's needed. And I'll say the last thing for sure with clinicians is be yourself.
Mm.
You do not have to be squeaky clean, and you will not catch Dr. Ty coming in there and being like, "Hi, my name is Dr. Ty,"
Mm.
and I'm like, like squeaky clean, like I'm perfect. No, I'm gonna come in there authentic and be like, "This is me." I'm a lead with passion, compassion, humility, and then also just understanding that this is a person in front of me, and I'm human as well. I make mistakes, and I'm very upfront about that, but I'm going to try my best and give it my all. So those are the things I would really encourage providers to, you know, think about as they're deepening their expertise in HIV care.
Dr. Ty, excuse me. Okay, I wrote down all the things you just said, and I'm gonna have to derail us a little bit. So curious, okay, no matter to your point, whether it's HIV care, whether it's pediatrics, whether it's geriatrics, whether it's leadership, if this is the space you're in, and this is something I say all the time, then it should be you should be a student in that space, and you should be curious about that and constantly learning. So I just put that out there, that if you are doing something, whatever it is, and you're saying this is what you want to do, you got to be curious, right? You got to be open and intentional and authentic in all those spaces. And
Right.
then, like you highlighted, the importance of a mentor. Like I think that I didn't understand the power of a mentor. Just recently, something happened to me, and these people, my mentors, that have been helping me before children, you know, you don't know the impact they can have on you until you see it. And then also to your point
Yes.
about our calling, we are called to mentor as well.
Mhm.
And I learned so much from my mentees. I swear, that relationship, I feel like sometimes I get more from them than they get from me, you know?
Absolutely.
Yeah, yeah. Thank
Absolutely. And I think the overall theme here is just don't take being a continuous learner for granted. Like we always say we're learning, but like really be learning with intention,
Mhm.
not just like, oh, I'm gonna take this CME. I'm gonna just take this class just to get through it. Let me get the CME credit so I can renew my license. No,
Right.
like really be intentional about learning and growing from that because you are always going to be a student.
Yeah.
Always.
Yeah. Absolutely. Absolutely. Um, all right. So, have you ever mentored new providers, like especially nurse practitioners who are navigating like early in their practice? And like, what do you do in those cases when you have someone that's new, like maybe a new nurse practitioner or someone new in the role of an advanced practice provider?
Oh yeah, yeah, yeah. As soon as you graduate school, you like I don't know if anybody can relate to me because maybe I'm the only one that have experienced this. I'll say, but when I graduated with my doctorate, I was like, "Am I a doctor for real? like, is this real? Like, do I actually know what I'm doing? Like, as an MP, do I actually know enough?
Mhm.
And that it's almost like similar to that imposter syndrome where you did it, you got it, but like you're still doubting yourself.
Right.
But what really has helped me is two things. One, a person told me, listen, Ty, you don't have to come out, publishing your research immediately. But the thing about the doctorate is it taught you how to do all of this stuff.
Right.
It taught you the skills to appraise research. It taught you the skills to build a clinical trial if you wanted to, and to get into the research and get involved. And beyond that, translate your research into clinical practice. So, those are some important things I took away from that conversation. Again, mentor, you don't realize how powerful that one moment
Mhm.
was for my career. And then the other thing is, you know, I tell people you do not have to know everything. It's too stressful to sit up here and act like I know everything. That's crazy. It's way easier to be like, you know what? I don't know that, but I know where to get the information. I know who to get in contact with. Leadership, like we talked about, is about curiosity and confidence. It's not about being perfect. And if you think that being perfect is, you got another thing coming, you know?
I can't say this enough, Dr. Ty. I have a so much respect for someone that says, I don't know. However, I can find out or I can ask this person. And it's so funny because I remember when I was working on my undergrad and we had to do like this big presentation at the end. And my advisor said to me, if you don't know the answer, don't make it up, Renee. Do not make it up. Say, I don't know. I'm going to write that down. And
Yes.
I got like three questions. I ain't know the answer, but I said that every time. I was like, I don't know. Let me write that down.
Yeah.
And that has been my practice, throughout as over the years as a professional. I don't know, but let me find out. Because what I've learned is when people make up stuff and you find out, I feel like personally, and this is just me speaking, Renee Roberts-Turner speaking, like you lose respect for them.
Mhm.
You can't trust them. And that trust is hard to rebuild. So to your point, being authentic and saying, I don't know, but let me find out for you, right? And then find out and then
Mhm.
come back, right? All of that helps to build the trust, and that trust is like it's currency that can't be replaced, right?
Absolutely.
Yeah, yeah,
Yeah, and I would also say, when it comes to new providers, like you got to understand that you're coming into a messy, like we're just coming into a mess. When I mean mess, it means it's
mhm,
just a complex system.
right,
Whatever system that you're coming into, it's leadership, whether it's clinical practice, whether it's both. It's healthcare in general. It's just complex. So
mhm,
you cannot really fault yourself for making mistakes or not knowing things. Like it's a complex system that you're navigating, and you have to always be resilient and not so rigid and like trying to like, oh my God, I gotta get this right.
right,
It's not a perfect system, so you don't have to be perfect. So, really lean into being more resilient and adaptable versus just feeling like, again, leaning into that perfection, feeling like you have to know everything. And that also can lead into burnout. So,
mm,
like, trying to be perfect, like, just give it up and really just accept that you are continuously learning and that you when you continuously learn and you take your time and you do exactly what you said, like, hey, let me just get back with you on that. Let me educate myself. People have way more respect for you. You don't burn out as quick. You actually can have some time where you can like possibly learn something new and grow from it, right? So, you know, you don't have to know everything. Be resilient, take your time, find balance. And then the last thing I would say is collaborate
Mm,
because it when you don't know, you need to know who to reach out to. Like if I got a complicated HIV case where I'm like, oh yeah, I don't really know what's
mhm,
going on here. And they got tuberculosis and all this other stuff.
mhm.
And I'm like, "I've never seen this." I'm gonna reach out to my ID specialist who been doing this thing for about 40 years, and I'm gonna get some information from them and see how I can work with them. If there's a medicine I haven't been really privy to, I'm gonna reach out to the pharmacist.
Right,
If there's a way that this person needs medication, I'm gonna reach out to the social worker. You know, you don't have to do this by yourself.
right, exactly, exactly.
Mhm.
I love that, Dr. Todd, because I think that speaks to the relationship piece, right? And how important that is in terms of building and maintaining and sustaining those relationships. We put a lot of time into those and you do that because it's currency, right?
Yes.
Again, you can go like you said, if you didn't have a relationship with this person, you definitely can't reach out. And I think that takes me back to what you said about going to the community and being involved. So going to the community maybe that you serve, right? But then also your professional community as well, building those networks and things. I know somebody we both know says your network is your net worth, and so that's a big deal in terms of having a community around you that can support you in the space that you need.
Mhm. And I think they also say, right, someone else we know says, "You give, we give, we gain, and we grow." Right?
Yes,
And I like that. And I'm like, yeah, we definitely give to each other, we gain from each other, and we grow together. You can't just give. You can't just do this alone. You know what I'm saying? This is a collaborative effort.
yes,
Again, it goes to that piece of you don't have to know everything. And if you want to do everything, sure. Like you can stress yourself out, you can burn out in a year or two,
right.
but like I'd rather, keep my peace and making sure that I have balance and understand that everybody has their expertise and build those relationships, stack on that currency that you're talking about and like really utilize it when it's necessary.
Absolutely, absolutely. Um, so Dr. Ty, how do you maintain excellence and purpose across clinical, leadership, teaching, mentoring, tying, all the roles, all the things?
All the things,
All the
right? All the things, right? Woo!
things.
This is something I would honestly say is something I am getting better with, and it it's taking time. It's
Mhm,
really taking time. Being a high performer, and you just have to find that balance. What really is keeping me focused though is staying like anchored in my purpose
mm,
for real. Just like knowing why I'm doing this. And
mhm,
sometimes you have to revisit the why for real. And that's really where I'm at in my season of like why am I doing this? Where am I at? My birthday had just passed, and that's really what I spent some time going up to Baltimore, took myself out to dinner, just getting myself together, just being escaping in a sense of just like, okay, what are we doing? Like, God, why am I here? You know what I'm saying? Like, it just the okay, all right. I think I'm understanding my why now. Okay, how can we move forward and build a plan from the why? My North Star has always been like just like holistic care, patient dignity, like treating the
mhm,
person as a human and with all respect. And so that has been like my thing. And really it's helped me really build strong relationships with my patients. And yeah, that's been my purpose, my North Star. But I also say, I'm trying to be very intentional about the activities and the tasks that I pick up,
mhm,
and making sure that they're contributing to my growth professionally, personally. and I'm not like just juggling things that I just can't,
Right.
like that's just really not serving a purpose. Again, aligning with my purpose, making sure that my teaching is integrating with my leadership style. Okay, cool. It's strengthening my clinical care. Okay, great. I'm learning from this experience.
Yeah.
And you know, I just this last year, I really, really took time to start modeling the things that we dish out because I prescribe stuff all the time. I'm like, exercise, check, eat right, check, de-stress, check, here are all the
Tell me more about that,
prescriptions.
Dr. Todd. Tell me more about that. Tell me more.
Yeah. And
Tell me more.
I've been having to prescribe it for myself and just really practice what I'm preaching to my own patients, taking that time that's needed, taking that time off of work, reevaluating my work relationships, reevaluating like, okay, do I need to switch jobs? Do I need to change like what's going on?
Mhm.
Do I have enough time? Is my schedule really supporting who I am as a person? Do I have enough time with my family? Do I have enough time with my friends? Am I engaging in the activities that really keep my spirit alive? Like, am I dancing? Am I swimming? Am I doing my yoga every day? Am I doing my prayer time? And I really had to be very diligent about changing my schedule to reflect that and then give myself enough time to make it a habit,
Right.
right? Because you can change your schedule around, but if you really not integrating it and you're not really putting it forth, you can kind of backslide
Yeah.
on it. And that's something I have to been really, really conscious about, just like really practicing what I preach and really being a model of wellness. And that has been super important. And I do feel that leaving a legacy is something I want to aim for. So it's something I'm continuously thinking about, like how I'm going to leave my mark. What
Mm.
am I going to do? So that's something I'm still sitting with, but I think it does come out of like being a healthy Ty, being a healthy me. And that's where the ripple effect will come. Like I'll be able to impact other people. I'll be able to impact my patients more. I'll be able to build from that space. So I hope that helps. But I feel like this is a thing that we go through from year to year. And I don't have children, so I know your situation probably is like, yeah, it could be month to month, every quarter,
It is hour to hour, hour to hour.
hour
I appreciate all of those. I think you hit on some really important pieces in terms of, like you said, speaking it, doing it. You can't you gotta lead by example. And I hear that. And it's hard though, because
Yeah.
I think we know all the right things we're supposed to do, right? But like I sometimes I just don't feel like it, Ty. I don't feel like it. Like,
Mhm.
that's normally the reason. That's my rationales. I just don't feel like it. But you're right. We really have to lead by example. And I think, the piece around legacy and purpose, going back and remembering that, putting it in your face, as you're making these decisions day to day, as much as you can to remind you, it kind of centers you almost when you think
Yeah.
about your why, your purpose, your north, whatever you want to call it, North Star, whatever it is,
Yeah.
that can center you and can really help you remember why you need to lead by example. Remember why you need to do all the things that are important to you so that you can continue to advance. And the
Yes.
last thing that you said, like, because you didn't drop a lot of
I'm
diamonds.
trying. Okay, I'm trying to drop them diamonds now. Let's get real.
Um, the intention, right? Aligning your actions with your purpose. Because what I've seen over time is people will just do things to do them. And I think for me, very early on, I realized that every opportunity is not my opportunity, right? Everything that's placed in front of me may not align with what it is I'm trying to do. So being very
Mhm.
strategic about what it is I do and don't do. But I think we have to revisit that. And then, like you said, going back to our purpose, going back to whatever our legacy is that we want to leave behind to make sure that our actions are helping to support that. So,
Yeah, yeah. I had this, you might have heard of, I think I'm gonna pronounce it wrong, but it's called like the Gallup uh um survey. I think I did a like a assessment.
mhm,
And I really like this assessment because someone had told me to go ahead and fill this assessment out. And
Mm,
what I found different with this assessment, which for our listeners, it's a leadership style. It's a leadership assessment.
okay, then
And
it's not
so
it's something else. Yeah,
you said it's what?
not what I said. So scratch. It's not a Gallup poll. I don't know what it is, but okay.
Well, it's I think it's spelled Gallup. It's like the Gallup assess, or I don't know if I'm pronouncing it right, y'all, but it's it was really helpful because it really outlined the top 10 strengths that I had.
Mm,
And I said, "Oh, okay, this was cool." So I learned from the strengths,
mhm,
and it challenges you to lean more into the strengths versus trying to like work from a deficit. And I
right.
was like, this is a good angle because a lot of the times when we do assessments, we're like, okay, what things can we actually like work to build and like to improve.
Right.
But this actually has challenged you to do the opposite of like leaning more into your strengths because you're good at that. So
Yep.
why not do work from that angle? And
Yep.
so I've recognized my strengths and I'm like really wanting to lean more into what I know I'm good at. That way it can help me in these areas of my life without having to be so stressful. And then it's also like helping me align with my purpose more and being more efficient.
Mm,
So
mhm. I love
yeah, hopefully, if y'all Google that, I don't know, I can't I
yeah.
can't give y'all the official name, but I know it's spelled Gallup.
G
But it was a long assessment, but I thought it was really helpful, especially for those who are looking to get into leadership or wanted to know their leadership style from a different angle and wanted to lean more into their strengths. So, yeah.
Yeah, you know what, Dr. Ty, I agree. I think that we shouldn't spend so much time focusing on our weaknesses. Strength finders is what it was called. It's
Mm.
I think it's something like that, and it's the Gallup, 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 to help individuals and teams identify and understand their unique talents and strengths. Yep,
Yes, and
that's
working from that point. So if y'all
yes,
got the opportunity to fill that thing out,
yeah.
do it. It was very helpful, and it gives you a breakdown of like how you can actually build on your strengths. So
Mhm.
yeah, I thought it was pretty helpful.
I like
Hmm.
that. I like that. I think that that is definitely a strategy to take because, you spend so much time on your weakness. You can hire somebody to do some of that stuff, and then some of it, maybe your strengths will overshine that weakness. That's the other thing too, right? If you really do hone in on, yes, it'll overshine it and keep it moving.
Yeah, absolutely, absolutely, and it doesn't reinforce the like the especially for my new MPs, like, or my new providers in general, it doesn't reinforce that I'm not good enough, like, voice or
Right.
like that false statement that
Mhm.
lingers in the back of your mind of like, I'm not good enough, so I need to do this. It actually is a strength-based approach, and that is what I love integrating into my clinical practice. And I said, dang, this works because any other assessment skill has made me feel like, oh, here we go. This is a highlight what I ain't doing right. You know what I'm saying? What I need to improve. Wow, I'm not good enough.
You need a 20, what is it, 30-day, 60-day, 120-day plan for
Right,
improvement.
right.
Yeah. Yeah.
So yeah, this is a little bit different. So yeah, I encourage people to look into it. I thought it was very helpful, and yeah. Hmm.
Nice. Well, Dr. Ford, or Dr. Ty, that's what I've been calling you. Dr. Ty, I want to thank you so much for joining us on the Let's Get Real Candid Conversations. For our listeners, if they are interested in reaching out to you to learn more about your work, how can they reach out to you?
Yeah, absolutely. Y'all can reach out to me through my website. It is www.tnj, that is Tom Nancy Jacob, wellness.com, and shoot me an inquiry on there. And then also, you can just text me through a secure platform that I love to use called Clara. And that number is 202-774-9726. You can say get real. You can say health, wellness, whatever you want. Hey, Dr. Ty. And then we'll go from there. I love to connect with our listeners. And yeah, especially if you are looking for wellness tips or just some coaching, if you're looking for primary care and here in the DMV area, I'm your guy to help you out. And especially if you are living with HIV or you're looking for prevention options, I can definitely help out with that as well.
Dr. Todd, thank you so much.
Of
It's been
course,
a
thank you. It's just wonderful to be able to do this. Finally, we be able to have this conversation. I've been anticipating it and just appreciate the platform that you are putting together for nurse practitioners and leaders out here doing the work. And I just appreciate you, Doc. And kudos to you for like really making moves. Like you a mover and shaker.
Thank you, Dr. Todd. Thank you. Well, people like you motivate me, so I really appreciate it. I'm grateful to have you in my space. All right.
Likewise,
Talk to
likewise.
you soon. Bye, everyone.
Bye, everybody. Ciao.